Welcome back. This section is called Ask FPA. You can send your questions to tv@fpalex.com and include your name if you would like for us to use it on the air. Tonight's question is, how do you know if your scratch is infected? My cats live outside and now I'm paranoid I'm going to get a disease from their scratches. Asked by Dawn from Winchester, Kentucky. And here to help me answer that is my associate at Family Practice Associates, Miss Lindsey Clickner, is a nurse practitioner. Welcome.
Thank you.
Now there is something called cat scratch disease, and it's not what the UK football team has either.
That's right, yeah. It is a mouthful. Cat scratch disease, or cat scratch fever, as it's commonly known, unfortunately is a fairly common disease. The CDC reports about 12,000 cases a year. Now, cats can be affected and infected with this bacteria and not have any symptoms at all. In fact, about 40% of kittens will have this type of bacteria. So what you want to look for in a scratch, if you were to get a scratch, is a blister or a bump around the area that you were scratched. Of course, if you see that, seek medical attention, and your doctor can do some tests or prescribe an antibiotic if they think that's necessary. Now, cat scratch fever causes inflammation of the lymph nodes around that area, and that can be something that can be very dangerous. In extreme cases, you have to have that lymph node removed. So it is important to seek medical treatment. So once again, if you have a bump or infected large lymph node around that area, fever, chills, flu-like symptoms, you should always seek medical attention.
Well, now, so we're talking about cats too, and one of the things that you got to be a little careful with in terms of litter box is toxoplasmosis.
Absolutely. So toxoplasmosis is a parasite that, once again, cats can carry. The egg of the parasite that is shed in cat feces is what is actually dangerous to humans. So they tell pregnant women, anyone that's immunocompromised or immunosuppressed, don't clean litter boxes, don't handle feces of cats or animals in general. Wash your hands after cleaning out a litter box. Toxoplasmosis can cause inflammation, fevers, and can be harmful to fetuses. So if you experience any of those symptoms, please seek medical attention.
Right, we talked about cats, we talked a little bit about dogs. We've got a dog, Diego's here.
Yes.
He's going to be here in a little bit, a dog from the Humane Society, but a lot of things we see in our office is dog bites.
That's
Is that something to worry about?
Well, let me first start off by saying don't let anything deter you from adopting Diego. He was precious. But yeah, dog bites. Yes, you always want to clean the area with soap and water. Same with cats. Apply rubbing alcohol, hydrocortisone cream. Cat bites especially need antibiotics after. Cats' teeth are like needles, essentially, and they do penetrate the skin and would require an antibiotic. Dogs, make sure that your dogs and your cats have had regular vet visits. Make sure they've had their vaccinations, including rabies vaccinations. Make sure they have their heartworm pills. They can carry worms, roundworms. You think of ringworm associated with pets, which is a fungal infection. So make sure they have all their treatments. Make sure they get their annual vet visits. And if you are to adopt an animal, whether from the Humane Society or off the street, make sure that they're up to date as well.
And anything, whether it be dog, cat, or any kind of bite that looks infected, you need to be looked at.
Absolutely. You need to be on an antibiotic.
Okay, so those are big dogs, but we've got a lot of animals like little insects. So it's not uncommon for people to get insect bites or what they think to be an insect bite on their body extremities somewhere. But if they see a little irritation, what's some things they can do before they end up at the doctor?
Well, at home you can clean the site with alcohol, wash it with soap and water, put a little hydrocortisone cream on it. A lot of times it's just a little local site reaction that causes the redness. So over-the-counter hydrocortisone cream would be appropriate in that situation. Now, if you start developing fevers or red streaks around that bite, you need to see your doctor.
Now, there's other things. There's some mosquito illnesses we need to pay attention to.
Yes. Well, of course, we hear in the news about West Nile virus and then the Zika virus. So luckily, we don't have a lot of incidences of that in the United States, but you have to be aware, especially if you're traveling, check the CDC's website, avoid areas that do have outbreaks in that area. And the best way to protect yourself is to wear bug spray with DEET. Don't put DEET on children younger than 1 year of age without consulting a pediatrician.
All right. That's great information. Thanks for coming in.